Good afternoon, everyone. Welcome to the last presentation of the Hidalgo County Wellness Program 2021 Virtual Wellness Fair. My name is Diana Hualpa with the Hidalgo County Wellness Program, and I'm very glad that you joined us today. Before we get started, I want to make sure that the technology is working for us today. Therefore, if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is located on the bottom of our Zoom webinar software. Again, if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is located at the bottom of our Zoom webinar software. Thank you so much for everybody that has raised their hand. It looks like we're good to go technology one. I do have a couple of reminders before we get started. Reminder number one is that all of our presentations are being recorded and are gonna be available on demand, especially the ones that we hosted yesterday. They are already available on our auditorium. So feel free to visit the auditorium and explore our on-demand sessions. Additionally, I do want to remind our audience that you are currently on listening only mode. However, you are able to submit your questions via our Q&A forum on our Zoom webinar software. We will have at the end of this presentation a Q&A session, and we'll be happy to answer all of your questions all of the questions you may have. At this pleasure, I do have the pleasure of introducing today's speaker, who is actually our last speaker for this 2021 Wellness Program Fair. And I am so happy to introduce Dr. Rudy Alvarez. Dr. Alvarez is a board certified anatomic and clinical pathologist by the American Board of Pathology and a fellow of the College of American Pathologists. His experience includes 6 years as medical director for 4 large acute care hospital laboratories, freestanding emergency rooms, outpatient surgery centers, and reference laboratory. Dr. Rudy Alvarez is experienced in working with federal, state, and county regulatory agencies, including a familiarity with the Joint Commission standards for hospital accreditation, CMS, Conditions of Participation, College of American Pathologists, FDA, Commission on Office Laboratory Accreditation, as well as interacting with these regulatory bodies during the time as a medical director. Dr. Rudy Alvarez has presented his work at numerous conferences locally and nationwide, and has received awards ranging from the Best Resident Teaching Award from Indiana University School of Medicine to the Texas Medical Association Leadership College. Dr. Alvarez currently serves as the Medical Director for South Texas Health System Laboratories and Chair of Infection Prevention. Dr. Alvarez, thank you so much for being here with us. Thank you so much for joining us this afternoon.
Thank you, everyone, for having me. If you see me sweating profusely, I'm in actually Cancun at the moment, and it's oppressively hot and humid here, but I never miss the chance of speaking to our community and our group. I think it's very, very important. Diana kindly invited me, and I think it's an opportunity to speak to individuals. Raise your hand if you're tired of the COVID. Everybody's tired of it, but we have some amazing things that have come out in the last few weeks that I definitely want to talk about, and more importantly, to answer any questions, any concerns. I'm completely here for you all to answer your questions if I can, and to be of service to you all. So can we look at the slide deck?
Absolutely, Doctor. I'm gonna go ahead and start sharing the slides. Just give me 1 second. And we do appreciate you being here and taking the time from being in Cancun, which I'm assuming is really nice right now.
If you see any people running around or just kind of jumping around, that's this is where I could get the best reception.
No, thank you so much. Let me go ahead and just prepare the slide for us, and we'll be ready just in 1 second. Perfect. Okay, let's go ahead and see if if you can just let me know if it's working for us. I would really appreciate it.
It's perfect. Well, thank you very much for having me. My name is Rudy Alvarez, born in the Valley, went elementary to college in the Valley. I'm And I came back after my medical school in San Antonio, went to training in Indiana, and I have been at South Texas Health Systems the past 10 years, and I'm very familiar with the community. It's a unique, diverse community, and I'm certainly proud to be there and to live in such a wonderful community. Next slide, please. So I wanted to review a few things. The first thing is what our current cases, hospitalizations, vaccinations are. There was an interesting NIH mix and match study, meaning that they produced a study that mixed Moderna versus Pfizer or Johnson & Johnson, and whether we can do that or follow the single 1-2 series, or did the booster all need to be from Pfizer? Did the booster need to be all from Moderna and such? And we have those results, and we've been waiting actually a couple of months. The next question is, who qualifies for boosters? Can you get a booster? And then there was a very important breakthrough by Merck, one of the most scientific driven pharmaceutical companies in the United States. And they have sought an emergency use authorization for the first oral antiviral. You heard it right, no more of this IV injections from monoclonal antibody. This would be a tablet. And then what's happening with pediatric vaccines? We just heard just this Tuesday alone, the 5 to 11 age group has been supported by the FDA Advisory Committee, which will be forwarded to the CDC. So we may see that in the next week to 2 weeks to cover the 5 to 11 age group. And then the importance of influenza vaccinations. Can these be given with COVID vaccinations? And then all the mental health implications. Next slide. So this is basically the vaccinated countries and where we stand in the United States against other countries. You can see we're in the middle of the pack. We're about, what does it say? About 66% of our population has been vaccinated. We don't exactly know yet what percentage is the magic percentage. We know from vaccines, we know from other illnesses like measles, mumps, that once we get rates that decline from 90 to 95%, we get outbreaks. So we're at 68%. We're going to get about 21 million eligible 5 to 11-year-olds that will close the gap as well. And we may soon get to herd immunity. But again, we've said we may be there and then we get another surge. So we'll talk about that, but that's where we stand against the entire world in terms of vaccinations. Next slide, please. So this is what's happening. Here is the United States in terms of vaccinations. We have about 220 million that have received at least one dose, and fully vaccinated about 200 million. So a good proportion. Some are still not eligible, like the 5 to 11-year-olds. We plan to probably see that in the next 1 to 2 weeks, pending the CDC advisory that's being forwarded from the FDA. Next slide. And this is what has happened since last May. We saw the surges. So here are the peaks and the troughs, and this is the last Delta peak from July, and we have seen a rapid decline from this. The question is it over? That's the biggest question. Possibly and probably. Next slide. And this is the daily new confirmed cases. As you can see, most countries are declining. Everybody seems to have their own spikes, but in general, most countries are seeing a decrease. Next slide. And here are the hospitalizations. They have followed the cases, and we're seeing a very sharp decrease in hospitalizations. We only actually have a handful of individuals with COVID at the hospital at this point. Next slide. And here are our COVID statistics at South Texas Health System, our 5 hospitals has, in terms of the cases and hospitalizations that we've had, and it follows very similarly the Texas, and gives more representation of what we're experiencing in the Valley. So we're seeing very few, much less than the Texas average. Next slide. So the question is it over? The outlook is very good. We're on the trajectory of burning it out. Usually, herd immunity equals vaccinations and people that have been exposed. We've had many vaccinations. We've had a lot of individuals being exposed to the virus, but it's unpredictable. We said last winter that we were probably at herd immunity, and then Delta came around. This was supported during the winter of 2020 surge. This was supported by a CDC study where we were finding antibodies, COVID antibodies, in 83% of blood donation specimens or blood donors. So we thought we were there, but this is a little bit different now. We have the vaccinations that are widespread now. We have most of America vaccinated at this point. The cases are plummeting. The vaccination exposure infection has increased, like I said, and there does not appear to be a dominant strain. On the right-hand side of this slide, you'll see, I'm gonna move here because the sun's hitting me. On the right side of the slide, you'll see that the dominant strain around the June, July became Delta. And that became the dominant strain that kind of took over, and we have not seen a strain such as this again. So we're still monitoring at this point, and we don't see any strains that have kind of taken over. So we do believe it's over. We have been wrong in the past. It's sort of unpredictable. It's like predicting the course of the pandemic. This is the reason why we're doing genotyping, or looking at the strains of the actual viruses to make sure that there's not one that's sort of the most prominent at this point. Next slide. So this is the important NIH study that came out, the mix and match study. We didn't know, do you have to take 2 Pfizers to complete your series? Does a booster need to be a Pfizer? Or what if you got a Moderna first? And what if you got a Pfizer? Is that effective? And it basically found that there's no need for brand loyalty. The FDA approved mixing and matching boosters. So meaning that if you got 2 Pfizers for your first and second series of vaccines, you can get a Moderna, you can get a Johnson & Johnson. One thing that the CDC kind of commented on the Johnson & Johnson, because we kind of said that that's the weak one, is it probably should have made that a 2-dose vaccine, because when they're 2 doses, their effectiveness went almost to 95%, equivalent to the Moderna and to the Pfizer. So at the end, some of the conclusions were that it's highly effective at preventing disease, matching and even exceeding the performance of the standard schedules, meaning that if you got a Moderna and a Pfizer, or you mix and match these vaccines, it exceeded the performance of the standard 2-dose brand type. So 2 doses of the Pfizer, 2 doses of the Moderna. It supports the use of vaccines in the standard or the mixed schedules. And one important thing that came out was the organ transplant and the immunosuppressed could protect better than the standard regimens. And one thing that applies outside of the United States is, since most of the world still doesn't have access to this, is that mixing these vaccines may benefit lower income countries where they may not get a steady supply of a Pfizer or Moderna or a Johnson & Johnson or AstraZeneca. So this is a very beneficial study that will have ramifications all over the world. Next slide. So it was very difficult for me to find, what age group. Moderna covers 18-year-olds, but the Pfizer is now 12 and up, and then the Johnson is 18 years old. So I found this picture very helpful, because at this point, the Pfizer is the only one that is approved for anyone over 12 years old. And then the second dose is given 21 days after the first dose, versus a Moderna is 28 days after the first dose. And then the third dose or booster for the immunocompromised may be given at different time intervals. So you can see that the Pfizer right now for adolescents, anyone 12 and above, is approved. And soon, probably within the next 2 weeks, we're going to see that the Pfizer will cover 5 to 11-year-olds, so anybody above 5. The booster, so the question is, am I eligible for a booster? Who's eligible for a booster? So the first thing that we came out was that the immunocompromised were not getting the antibody response from the vaccinations. As a result of their immunocompromised status, their immune system was not making the antibodies needed to produce this. So in some instances, they were getting 20% of the response, 30% of the response. So they were the immediate group that we wanted to cover. And the immunocompromised includes anyone with organ transplants, HIV, on high-dose steroids, and it is also approved for high-risk individuals. So any persons ages 65 or older, any persons 18 to 64 who are at risk for severe COVID-19. So for example, diabetes, asthma, heart disease. So those individuals can receive the booster. And then any person ages 18 to 64 whose institution or occupation involves healthcare or teachers or daycare, or any kind of high-risk settings. The booster is very important because what we're seeing is waning immunity or decreasing antibody response, usually within 6 months. So this is something to consider because COVID is likely here to stay for some time. So again, this is helpful just in terms of when the first dose, second dose, and third dose, and all the different vaccines. Next slide. And here's the Merck study. Merck just came out. They're seeking emergency use authorization from the FDA. And they showed that this oral antiviral called molnupiravir reduced the risk of hospitalization and death by approximately 50% compared to placebo. And those were for mild or moderate COVID-19 positive patients. And this is a phase 3 FDA trial. So 7.3% of the population that they studied received this, and through day 29, compared with 14% of the placebo treated. So this would be the first oral antiviral medicine for COVID-19, very similar to medications that we give for the flu. So an opportunity for this to be given by physicians and no need to go to the hospital. The interesting thing about this antiviral is it doesn't really target the spike protein. It's a general antiviral. So we do expect that even if the virus mutates, it will be effective. So next slide. So what should we know about the pediatric COVID-19 vaccines? Well, the first thing is that the Kaiser Family Foundation survey found that only about a third of parents plan to vaccinate their children right away. This is probably because parents want to do their research. They want to know that this is safe. And education is going to be central to this. The FDA Advisory Committee just this Tuesday recommended approval of the Pfizer vaccine for children's ages 5 to 11. Those younger still need to be masked. The study consisted of 2,268 enrolled participants throughout the world, and it showed with robust neutralizing antibody response using a 2-dose regimen. This is different. Adults and adolescents are receiving the 30 microgram dose 21 days apart. And for the 5 to 11-year-olds, we used a 10 microgram dose and they produced the same response. This is because children usually have a more responsive immune system. So hesitation is understandable, but the education is essential to understanding more about this pediatric COVID vaccine. This is endorsed by the American Academy of Pediatrics, and it's certainly the benefits of the COVID-19 vaccine outweigh any risks, and we'll talk about that. Next slide, please. So, do young kids need to be vaccinated? Children are less impacted. They tend to do very well, and they may experience mild symptoms to none at all, but it's still a serious illness. What we've seen is that there is a condition called a multi-system inflammatory syndrome that may have long-term complications in children. And also by just sheer infection. We want to prevent this because we don't want to have them in the ICU. We don't want to have any children die on us. But it is a serious thing to give a vaccine to perfectly healthy individuals. And we have to weigh those benefits against any potential consequences. But what we're seeing in children is when they do become infected, they are at high risk of developing this severe inflammatory syndrome in multiple organs. The second thing is that kids can transmit the virus to adults at risk for severe illness. We tend to live in a community with multi-generational homes. We have the grandparents there, and the kids may represent a reservoir for the virus. And again, the children represent an unvaccinated population, and this allows the virus to circulate and to mutate into dangerous variants. Next slide. Are the COVID vaccines safe? That's the most important question. The FDA Advisory Committee found 0 deaths or significant adverse events in the Pfizer vaccine trial for kids. Again, this was a small study of about 3,000 children. We'll know more, but the side effects are very similar to what teens and adults are having, but actually with less severity. So what we're seeing pain at the injection site, we're seeing fatigue or headache after the second dose, and kids experience the post-vaccine fever and chills at a far lesser rate than adults with much less severity. So kids do better than us. They have less symptoms and less severe symptoms. Even with a lower dose, it was more than 90% effective at preventing symptomatic infection. Some of the myths that are circulating that we have to address is, does it create long-term health problems, or does it affect future fertility or development? This is very similar to the other vaccines that we had. There are no studies, there are no indications that this would cause fertility or health problems in the children. Next slide. But we have heard that there are heart problems linked with vaccine in kids. In fact, myocarditis is an extremely rare side effect seen in men under 30. There have been about 800 cases in over 50 million individuals. So you can understand that it's much less than 1%, much less than 0.3% of the population. None were seen in this study. The FDA said Tuesday that it hasn't seen any uptick in myocarditis cases in the 12 to 17-year-old group. So it seems to be more in men that are older than 18 years old, less than 30 years old. The COVID infections actually can cause myocarditis and the multi-inflammatory syndrome at much higher rates and alarming rates than COVID vaccines. So again, I'll emphasize, while there may be a rare case of myocarditis, if you are infected with COVID, your likelihood of getting myocarditis and multi-system inflammatory disorders are much higher than having received the COVID vaccine. So again, this is why the American Academy of Pediatrics says the benefits far outweigh any risks. Next slide. And then we were initially told last year we had to separate the vaccines from the COVID-19 vaccination. So any influenza and measles, mumps, all that had to be separated. That is no longer the case. We understand what the risk profile is for COVID-19. Initially, we wanted to make sure that we were identifying any problems with the COVID-19 vaccine and not mixing those up with a flu vaccine. We understand it after these trials, after a year of having the vaccinations. So it's important to really get the flu vaccination. It is available right now. The influenza can cause myocarditis. It can cause these same things. It can cause the same symptoms as COVID. And we want to make sure that we don't mix those things up. The flu outbreaks were limited in 2021. We didn't see much of flu, particularly because of the COVID-19 prevention measures that we were taking, masking, distancing, staying at home. But the flu can have serious complications like pneumonia, asthma exacerbations, myocarditis. And sometimes the strains are more virulent. This year, the flu vaccine is going to cover 4 strains that we think are going to be the most common strains. It's a quadrivalent vaccine. And the flu vaccination is the best way to prevent the flu. So if you haven't gotten that yourself or for the children, that is available already. Everyone aged 6 months and older is recommended to get a yearly flu vaccine. And because the flu and the COVID-19 share many of the symptoms, preventing flu means fewer people will need to seek medical care. Imagine you have a fever, you have coughing, the first thing you think is COVID. Well, could it be the flu? Getting the vaccine means that we will need to seek less medical care. We will need to test for the flu and COVID-19, but getting the vaccine saves time, money, stress, and the flu vaccine, again, can be given at the same time as a COVID-19 vaccine. You can see on the right that the rates are actually very low for our population, about 60% children 6 months to 17 years. And you can see the rates there. We'd love to get them in higher, especially in pregnant women. The data on pregnant women has been mixed, and many have chosen not to get it because they don't know information. We don't want any pregnant women to not get the COVID vaccine and not get the flu. There needs to be no needless deaths from that. Again, and it's because people aren't sure about this, but it is recommended in those individuals. Next slide. The mental health has been disastrous. There's depression, there's anxiety. We have the great resignation, we're calling it now. People are very stressed, they have panic attacks, there's alcoholism, drug addiction, and emotional disturbances. This is a very PTSD symptoms. So we have had upticks of suicidal behavior. We again see these in economic crises, financial crises, natural disasters. The thing is, these disasters don't last for so long. This has been so long, and COVID has been with us almost a year and a half, and there is this chronic fatigue and chronic stress leading to this psychiatric epidemic co-occurring with this epidemic. And the interventions like quarantine, isolation, have benefits, but they also have consequences. And the age, gender, marital status, occupation, exposure, all have factors um, into this type of stress. I can tell you from personal experience at the hospitals are having very difficult time staffing, and there's been this mass exodus, and it's understandable, especially in women who are often the caretakers for children and for family members and for parents. One of the first things that I was told in medical school by the physician that taught us the history and physical exam is make sure to have one girl, because they're going to be the ones that take care of you when you're older. And it's true. And it's true. We saw individuals, nurses who were in our hospital for 20, 30 years, leaving to other states to take care of family. And it has been an especially hard burden for women. And we can't go forward without addressing those disparities and making sure that those needs are met. And employers are going to have to be more flexible. And we're seeing that already. Next slide. So the recommendations for stress are, again, and we're seeing this. I have never seen more individuals out on 2nd Street on the trail. I'm very familiar with that trail, walking, enjoying South Padre Island, just getting out. It's very beneficial for the mind. 2 to 3 minutes of a walk, 30 minutes a walk for a few days is very beneficial. Having a healthy diet, avoiding alcohol and drugs is very beneficial. Sleep is essential. Keeping a routine and maintaining that sleep schedule has more benefits than we can talk in this discussion. We could talk for hours on sleep cycles and the benefit of sleep and towards mood, towards energy, participating in social activities. We've seen churches empty. There's a population in our community that church is essential to that. That's part of who they are. It's their family, it's community, and making sure to promote those things. Next slide. And this is a slide that I presented before from the CDC, showing how sleep loss leads to a decrease in the immune system. It leads to decrease in our T cells, our natural killer T cells that can increase viral infections and even cancer. Our natural killer T cells kill cancer every single day. Right here under the sun, I'm being irradiated by the UV light, and our body is incredible and can kill those cells that are not replicating correctly by a means called apoptosis. There's a lot of science behind it. Sleep loss can also lead to inflammatory cytokines, more cardiovascular and metabolic disorders. Sleep loss can also lead to antibody production. So whatever it takes, for me, usually turning off social media, turning off televisions, and having a cutoff time where I'm no longer exposed to that. I like to take melatonin, 3 milligrams, and it's very beneficial. Melatonin crosses the blood-brain barrier. It's a powerful antioxidant. It's been linked to a decrease in neurodegenerative diseases like Alzheimer's, Parkinson's. A simple thing like melatonin can help you in your sleep cycle. So what happens, this was taken from UT Austin for the students. What happens when you don't sleep? Judgment and concentration are impaired. Your reaction time is slowed. Your emotions are heightened. You're more irritable, angry, and anxious. Your immune system is suppressed, and your release of more appetite. I know every at 12 o'clock, if I'm still awake, I find something to eat, and I'm eating. So that's certainly true for me. Next slide. Here is a paper that just came out a few months ago on psychiatry, and it was a 20-page paper. I'm not going to review it, but the summary was that COVID-19 is followed by significant rates of neurological and psychiatric diagnoses over the next 6 months, and we need to produce much more services and adapt to this to deal with this anticipated need. Next slide. So there was over 236,000 survivors of COVID in the study. It's one of the biggest studies. It's a 6-month neurological and psychiatric outcomes. Next slide. And you can see that in these individuals some of the neurological symptoms of COVID, they had some intracranial hemorrhage, stroke, but we also saw dementia, we also saw mood and anxiety and psychotic disorders, not always just associated with COVID-19, but all the co-related factors that we talked about, the suppression from the family, not seeing the kids, not seeing the grandkids, not seeing family, not being able to travel. Those are important things to get back into our routine. Okay, next slide. So here is a paper by Forbes, and I think they just put it out today. I was trying to search for interesting things for you all to see. And this is the great exodus, the great resignation, and it's time to talk about the working dead, the unhappy, the unmotivated, the remainers who didn't quit in the great resignation. There's this chronic fatigue. Those of us who stayed and have been working, the study found that they were neglected and disconnected, and that there was a divide between employees who believe are the most important benefits to make them stay versus what executives or the leadership. And the top 3 were they wanted better compensation, they wanted better work-life balance, and better benefits. And meanwhile, the top 3 reasons executives think workers are searching for new jobs are better benefits, better career advancement opportunities, and discomfort in the workplace due to COVID-19. And we're still seeing this resignation tsunami. It's still occurring, and we don't see a stop to this. 52% of those who chose to stay say that they've had to take more work on, more responsibilities. In fact, the productivity has actually increased. These workers left to reconsider their options, as 30% report struggling to get necessary work done, 27% felt less loyalty to their organization, 28% felt more lonely or isolated, and more than half now wonder if their pay is high enough. So there's an evaluation. Usually when people leave, they're non-rehirable. That's something that we're gonna have to absolutely reconsider. There's no choice. Organizations are struggling, and it costs more for organizations to retrain individuals. Next slide. The study showed that business leaders are taking steps to combat the resignation. So 60% of companies reported that they are offering higher starting salaries and wages than last year. And of the human resource professionals who witnessed significant turnover in the past 6 months, 42% of the organization has implemented new or additional remote work and flexibility options to reduce turnover. 32% had increased employee referral bonuses, and 28% introduced new additional merit increases. I know this is true at South Texas Health System, and we're seeing this throughout the Valley. So if you've seen this in your organization, you're not alone. This is a widespread thing across America. Next slide. So just to recap, vaccinating younger groups is safe, and it's going to keep the US moving forward to an endemic phase. Endemic meaning that the virus is still going to circulate, but at lower levels than it is now. the side effects of getting vaccinated are minimal, and the benefits of the shots outweigh the risk of infection. We're getting new therapeutics like the Merck antiviral that's going to make it much more quick. Currently, the monoclonal antibody infusions through IV are cumbersome, they're expensive, they take a few hours, they need to be done at infusion centers, and we'll have medications such as Tamiflu for influenza. So we hope to be able to get enough of this going forward. The US is going to require vaccination proof and negative tests within 1 day of departure when foreign travel curbs lift on November 8th. So we'll require that for foreign travelers. That is something that's going to be going forward. In fact, when I go back to the States, I'm required to have a PCR test, a negative test. Moderna and J&J are not left out. They will submit their data and the EUA, the emergency use authorization request soon, probably in the next month. And the CDC has allowed cruise ships to operate since October 2020, requiring masks, vaccination, or testing, and we'll extend that into January 15th. So that's what I have for you. Any questions for me?
Thank you so much, Dr. Rudy, for these informative presentations. There are questions, so at this point, I'm going to go ahead and share my screen just so we can go ahead and start our Q&A session, and we'll start with the questions. Perfect. The first question that we have is there a difference between the third vaccine and the booster?
So no, actually, there is. So there's a series of two vaccines, and we consider the first and the second vaccine to be fully vaccinated. The booster vaccine is meant to produce higher antibody levels. We're seeing declining antibody levels after 6 months. The booster is the same. Moderna's booster is actually at half the dose. They're submitting at half of the original dose. The Pfizer is the full dose. So we hope that as new strains come out, that they adjust those mRNA vaccines to new strains that are emerging, just like we do with the influenza vaccine. But at the moment, the booster is exactly what it's called. It's just meant to boost the levels of your antibodies. Now, with Delta, we saw that even with two vaccines, they were breaking through. We call them breakthrough infections because they were breaking through the levels of the antibody. They just overwhelmed some individuals and the antibody levels that we were seeing. And in fact, 65% of the breakthrough infections and hospitalizations for fully vaccinated individuals were the immunocompromised. That's why we acted so quickly with the boosters. Individuals, a lot of individuals are on steroids, prednisone, asthmatics, any rheumatologic diseases like lupus. So it was very important for us to boost those because they did not produce the antibody levels that were needed. Is also in the age 65 years and older, they were producing less of a response. But by and far, they're the same. The dosages may be different from company to company.
Thank you so much, Dr. Alvarez. And the next question that we have is, how long does a person who had COVID-19 and was hospitalized for COVID pneumonia need to wait before getting their first COVID vaccine?
So the recommendation is 90 days by the CDC, the current recommendation from what we've seen. Not because there is a problem with cross-reactivity or reactions, but because we want the duration of the antibodies. So if you get a COVID infection, you are creating natural antibodies. We want the vaccine to be usually 2 to 3 months before you get the vaccine to create a longer duration of these antibodies. You have already, by being infected, created antibodies, and the recommendation currently is 90 days.
Perfect. Thank you so much. And we do have time for one more question. And the question is, if I got the third vaccine in September, should I receive the booster later on? I am diabetic with high blood pressure.
That's a very good question. And I would refer, if we can go back to the slide, actually.
Yes, definitely.
Because I certainly cannot remember this. I will get it wrong. Into that booster slide.
Yes, absolutely. I'm just pulling out the presentation and she'll take just a few seconds. Okay, then go ahead.
That's a very, very good question. So here we go. So let's see, the booster available 6 months after the second dose. So the recommendation is if you got it in February, you should wait 6 months after your last dose. That changes, believe it or not, it all changes. If you got the J&J, basically the CDC said, yeah, we really should have given 2 doses, okay? You're just like Moderna and Pfizer, and you're creating a 90%, 95% effective dose. So you can see there, the third dose under high risk is 6 months after the second dose. That changes for the Johnson & Johnson. I don't think it's on the slide. They basically said, do it now. So if you received a J&J, you should get a booster. But in general, 6 months is what we want to see, because we are seeing declining antibody levels. After about 6 months, Pfizer was saying that they had, it went from 95% to 84%. So we want to boost those as much as possible. I got the booster. I can tell you, it was fine. My arm felt like it was going to fall off, and that's about it. There was no problems otherwise.
Okay, well, thank you so much for being here with us, Dr. Alvarez. Thank you so much. I really, really appreciate being here. And it is a pleasure to have you as our closing speaker. I have been enjoying working with you in the past, and I'm so glad that you were able to present for the 2021 Wellness Virtual Fair. Thank you so much, Dr. Alvarez.
It's always a pleasure. Thank you so much.
Thank you. And at this point, I do want to take this opportunity, as this is our last presentation for the Hidalgo County 2021 Wellness Fair, to thank the Hidalgo County Wellness Program team that has been behind the scenes planning this event for over 4 months to ensure that we host an interactive and educational event for all of our Hidalgo County employees, especially to David Perez, who is our Wellness Program Multimedia Specialist, and Ms. Angela Howell, who is our Wellness Program Administrative Assistant, and of course, Hidalgo County Budget Officer, Mr. Sergio Cruz, who has been supporting us throughout this planning process. I also would like to welcome Diana Salinas, our new Wellness Program Coordinator. Diana, welcome to the team. Thank you, everybody. It has been a true pleasure serving you as a Hidalgo County's Wellness Program Coordinator for almost 3 years, and it fills me with joy every single time I learn about the positive impacts that this program has brought to you, our Hidalgo County employees. And I can't wait to see how this program will continue to grow. We're here for you because your health is a priority, and it is our priority. And lastly, I do have great news for all of you. This event is going to be available on demand for the next 30 days. Therefore, you're going to be able to download all the documents that we have on the booths, on the exhibit hall, and also watch all the presentations that we have hosted on demand as well. Thank you again, everybody, for joining us. Thank you for joining us and being active in all of our events. I do appreciate your time being here and your engagement, and I hope you have a great day. Stay safe and stay healthy. Thank you so much.